everyone, and welcome back to episode 4, talking about terms 3 and 4. Now, in terms 1 and 2, which I talked about in the previous episode, I did forget to mention that both of those locations that I was placed at were long-term care. In the midst of everything that was happening with COVID, we were intended to be at the maternity unit. However, we were moved to long-term care for term 2. So in terms 3 and 4, the clinical placement was acute care for level 3, and for level 4 it was the Children's Hospital. Now, in terms 3 and 4, there is a tremendous amount of group work and projects. Now, projects are very stressful. They're usually worth a large component of your class, and you do have to work together as a team to get them done. Now, I really disliked doing group work. I always found that there was 1 or 2 people that just never really carried their weight, and unfortunately you just kind of have to accept that and go in knowing that you might have to do more work than you bargained for. However, you can always do the evaluations at the end of a group project and really speak to the point of everything that you did and the fact that you tried to communicate to others and were just having a hard time getting through. So group work, mainly it's just tough and you do have to get through it. I would recommend trying to nominate a leader, someone other than yourself, so you don't have to have that extra stress, but have someone leading the group and set a timeline and try to get them done early so that they are not all compounding at the same time when you do have exams. Now, for level 3 and 4, again, I want to go over the fact that you need to ask questions and be okay with being embarrassed at this scenario because you are still a student, you are still learning, and it is a very safe place to do so. Now, one thing to do with safety and being a woman in nursing, I found that it was always really important to make sure that you're never alone with certain patients. You are dealing with a large variety of different patients, and if you are in a room with someone that maybe has dementia or it could be dangerous, you always want to remember that you never want to put anything between yourself and the door. You always have to make sure that you are taking care of yourself and that you are safe first. And if you do not feel safe in a certain area, speak to that, talk to your preceptors, and see if you can either buddy up with someone or change your assignment. Another thing with that is don't be afraid of speaking to that and asking to be changed. I had actually done that a few times because I did not feel safe in certain environments. Now, one thing with not being a hero is don't wreck your back. I did see this a few times where people would run in to help someone that was maybe a 2-person assist, and they would try to pull them up from the ground or do something like that by themselves. Now, it is your back and your body, and it takes a long time to recover from injuries. There is a reason that that person maybe is a 2-person assist or something like that, and you just really don't want to be a hero in those scenarios. Go and get help and make sure that you're doing things correctly. It's your body first and foremost, and that patient will be safer at the end of the day having what is meant to be helping them help them. So if it's 2 people, that's safer than having 1 person and potentially having you both topple over. The clinical component of level 3 and 4, I did definitely use it as exam prep because I found in level 3 and 4, even more so than level 1 and 2, the material that you're learning in class really lines up with what you're doing day to day in your clinical environment. So it was really helpful to kind of push myself to try a lot of different things that I was learning in the textbook and ask my preceptors if they could do something with me or show me how to do a certain technique that I learned. And then I was using that as kind of helping me study for exams, but also just becoming a better nurse and trying to expand on my skill set. Okay, so with learning the fundamentals, I did mention this in the last episode. This is so important. Again, I saw a high level of people get lost here, where if you don't know the foundations from levels 1 and level 2, you will get completely lost in levels 3 and 4 because they just continue to build and compound on those base levels of knowledge. So really important that you get to know those base levels of knowledge and you don't just memorize things, you really truly learn them. Now, wrapping that up, nursing is a high attrition program. For example, with my particular program, I started with 240 people and we ended up graduating, I believe, just sub 90. It was 87 or 88 people. So that's a huge amount of people that didn't make it through the program and left for various reasons or just couldn't get through it. Now, nursing is tough. I did have a full-time job when I did this, and I found that it was manageable by setting my days up properly. So I do feel like if you do set yourself up and you stick to a schedule, you can make it through nursing no matter how hard it gets. So level 3, term 3, is known as the scary term. It was the one with the heaviest courses, and these are things like pathophysiology, pharmacology, and of course they are very, very big courses, but I did find that it was manageable. Of course, the textbooks that you're getting are about yay thick, and you can really dive into things, but keep in mind that you're only being tested on certain things. So when you're going through, say, your med-surg textbook, you're going to have all the different kinds of respiratory diseases. So instead of going through on your own and reading and doing that low yield textbook page by page reading, know that you are only getting tested on a few concepts. So maybe you're only being tested on COPD. So you would go and look at the exam breakdown or look at the course outline and look at exactly what you're being taught and being tested on, and don't dive into all of those other things. You can specialize after if there's an area in nursing that you're really, really interested in. You're never going to know everything, so don't try to do that and overwhelm yourself when you're studying for your exams. To wrap that up, I just want to hammer home to study effectively. Please do not get overwhelmed by the largeness of all of these courses. You are tested on only a certain amount of things. You can only get through so much material in hours of lecture every week, and then they can add on a certain additional, I think it's an additional 4 hours of self-study, additional material for you to be tested on at the end. So know everything that's in that course outline that will be tested on, and don't go and overwhelm yourself with getting into everything else, because it will not help you when it comes to exam time, and ultimately it's going to be knowledge that you won't be able to apply anyways when you're going through your training. It's something you can specialize in afterwards in that specific area if it's interesting to you. Now, the jurisprudence exam came up in term 3 to do in term 4, and they did actually recommend us to do this in term 3 because in term 4 it's 2 months of class time, so you're actually 1 month shy from what the other terms are, which are usually about 3.5 months. So you have the ability to take on the jurisprudence exam, and the jurisprudence exam is it's ethics and it is open book. However, you do need to really familiarize yourself with the CNO and make sure that you know which pages to go to. There will be certain things that you do inevitably have to look up, but you don't want to be just winging it. Just go through your ethics, make sure that you have a good idea of where everything is if they're asking you a very specific question, and then try to get that jurisprudence exam done as soon as you can. The jurisprudence exam, for those of you that don't know, is something that you need to be a nurse in Canada. Well, actually I'm not sure if it's in Canada, but specifically in Ontario. You need to have your jurisprudence exam and then pass your board exam. So as soon as you can get the jurisprudence exam done, I would recommend you do so, because you don't have to wait until you've done all of your studies to do it. Now, portfolio prep is the last thing. I, again, do not have the document to show you, and I will show you in a later episode. However, the portfolio is a culmination of a lot of different things that you've now put together throughout your terms of nursing. So it comes into term 4, where you're preparing this giant portfolio of yourself and your information and your knowledge, and you're giving that to your preceptor that you're consolidating with. So it will include things like your resume and your cover letter and your clinical hours and experience, called a clinical snapshot. It will also talk about your CNO ethics that you are working towards and things that you are focusing on, and basically just a background on yourself. Now, if you think about it, and they will not tell you this because it's basically like giving it to you on a silver platter, you will go through all of these in different elements through nursing communications and communications as a healthcare professional in your kind of elective courses. So if you've done a good job on those assignments and you've kept all of those assignments hopefully in your computer, you can pull your resume and your cover letter that you would have got back and you would have gotten marked, so you know that it's a good piece of submission. Then you don't have to create everything from scratch. So something to keep in mind when you're going through terms 1, 2, 3, and 4, that you will do all of these elements at separate points. They don't tell you that, but if you kind of think about where all of these are, it'll be really easy to put them together and make a really nice portfolio. All right, that is everything for episode 4, talking about terms 3 and 4. Thank you again for watching this segment, and I will see you guys back in episode 5, talking about consolidation.